I want to take a closer look now at what Ann just mentioned in her piece at the top of that report concerning the rise in respiratory cases in China, wreaking havoc on the hospital system there and involving children. For more on this, I want to bring in Dr. Amish Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. Doctor, thank you so much for joining us tonight. What do we know about this cluster of cases in China?
What we know is that they're not being caused by any unusual pathogen, not a new virus, not a new bacteria, but a conglomeration of all the usual things that make kids sick, all attacking at once. And this is something similar to what we did last year in the United States and Canada, where RSV, influenza, and COVID all attacked at once. And that's what's likely happening there.
We look at this video, right, and you're seeing crowded hospitals in China. And with China's history of not being forthcoming with the global medical community, should we believe them?
I think we should believe them in this situation. We know that China has not been transparent in the past about infectious disease outbreaks, but this makes biological sense because all countries went through this on some time scale when they lifted social restrictions. And China was under restrictions for about 3 years or so. And we had the WHO being very forceful, asking for information, asking for data, asking for tests. And that's not something the WHO usually does publicly. They maybe go through backdoor channels. They're being very public about it. So I do think this is something that where we can trust them. But in general, yes, you have to be suspicious of anything that they say.
So China is saying it's not a novel pathogen, right? Like, as you're saying, they're saying this is just people coming out of COVID. Over there, the restrictions were a little bit longer than over here, and it's people getting sick because the weather's getting cooler. Do you believe them that as well? And how do we actually know if it's a novel pathogen or not?
Well, I do believe them because all countries, as I said, went through this. Yeah. How do we know? By looking at the data, asking for lab test results, asking them what's going on, having individuals there, doctors speak freely about this. And even before China said that this was not a novel pathogen, many of us in the field had been tracking this all over Thanksgiving break. And basically, we're coming to that same conclusion, that this seemed to be usual pathogens.
Tracking it, peel back the curtain for our viewers. What do you mean by that, doctor?
It means talking amongst ourselves, using email listservs, those same listservs that blew the lid off of the COVID, blew the lid off of the first SARS. All of those were really consistently saying this is likely all ordinary pathogens infecting people. So we are always talking to each other behind the scenes when any outbreak occurs anywhere in the world, trying to make sure that we have a handle on it.
I know you mentioned this when you were explaining why you sort of believe China now, but what is China saying? Why are we seeing these images in their hospitals, like crowded, and what are they attributing it to? Just regular RSV and other COVID cases maybe? And
exactly, yeah. So they're basically saying certain bacterial pneumonias, RSV, COVID, adenovirus, all the usual mix of respiratory viruses and respiratory bacteria that infect people. That's what's happening. They are opening up extra fever clinics to take care of some of those patients, just like we did last year. We had tents in our ER parking lots for RSV patients. So that seems to be what's going on. Remember, pediatric hospitals have very little capacity. They're not able to absorb a lot. So it doesn't take a lot for pediatric hospitals to get into trouble anywhere in the world because there's just not that many pediatric beds.
What does it take for something in China now, knowing what we know after COVID, for it to reach your radar to say we have another problem in China?
Well, China's always been on our radar because this is a place where we track, for example, bird flu cases, where we have humans and birds all in very close proximity. So China is something that we always look at anything that happens there, whether it's COVID, whether it's bird flu, whether it's the first SARS, whether it's plague. All of those things happen in China. It's just a conglomeration of factors there that makes emergence of disease likely.
And you guys know it because what? People are in China telling you, hey, the hospitals are full, it's getting kind of crazy, and then you guys start to talk amongst yourself in the community.
Yes, we start to hear about these rumors on all of these listservs, all these old-fashioned ways of email. People start talking to each other, and that usually raises the alarm.
Dr. Amish Adalja, always great to have you here. Thank you. Coming up next, an update on Pope Francis, the 86-year-old leader of the